We just said that we can enlarge the penis. Not that there are any magic pills, injections, or processes. But we have to exercise the penis or we have to have surgery. We can gain 1, 2, or even 3 inches in length. But what about the other aspect? Thickness.
This is the second stage. Let's say that the patient has increased his length with the andropenis or through surgery or both. The andropenis does not take away thickness, but optically it appears that way because it is longer now with the same thickness as before. For example, if we add 2 inches in length, it is going to look thinner because it is not proportional to the length gained. Now we enter the patient into the second stage, namely, the thickness needs to be increased because now it appears thin. So, to thicken the penis, the patient must first be circumcised. We cannot thicken an uncircumcised penis. So, if the patient is uncircumcised, he must get circumcised, and 2 months after the circumcision, we can thicken the penis.
So, it must be circumcised?
That's right. Years ago, we used to use the famous lipophily. That is when plastic surgeon does liposuction, removes fatty cells, and we put the fatty cells in the penis, but this procedure is only a temporary solution. 25 to 30% of those fatty cells are reabsorbed in the first 3 months, and within a year and a half, almost all have entirely disappeared. This happens because there is always reabsorption of our own fatty cells.
It thickens, but only for a very short time.
Right. Currently, we use a very fine material, a Brazilian material, that doesn't cause any side effects, that doesn't cause any reaction, and of course doesn't cause any inflammatory problems. This material is called polymethyl methacrylate, or PMMA. Of course, we use the original PMMA, which was created by the prestigious and internationally known Dr. Amir Mogen Akult. He is a Brazilian physician, and I am honored to be one of his students in Latin America. This technique is called bioplasty. It is a synthetic procedure that consists of filling the penis with implants by a minimally invasive process. The result is permanent. The implant will be there for life. It is permanent and has extraordinary functionality.
When you say implant, I imagine women's breast implants. Is it the same?
More or less. We place this gelatinous material at the top of the cavernous arteries. We use an injection and we thicken in such a way that is, as I said, minimally invasive. Through bioplasty, we can return the lost volume or a desired volume to the penis with regards to the flaccid or the erect penis. This technique is safe and much less aggressive. It doesn't leave hematomas, and the recovery is practically instantaneous. The patient returns to his normal daily activities instantly. He doesn't need any disability leave. The only thing we ask of him is not to have sexual relations for 45 days after the procedure so the material can set correctly.
Doctor, with the introduction of the thickening agent, does this leave the man with any undesirable effects like the loss of sensitivity?
Of course not, and this is because, as we commented earlier, it is placed internally and the male's sensitivity is in the skin. So, there is absolutely no reduction in sensitivity. Imagine a penis with better length and better thickness. No doubt one would feel more interested and more confident in his sexual relationships.
So, in that case, we can say if women get implants, why can't men?
Yes, of course.
Women augment their chests, their butts, and their legs.
Yes, and we are the pioneers of this technique for men. 25 years ago, when the Mexican woman wanted implants, they had to go to the United States. Plastic surgeons didn't have much work here in Mexico. It was a taboo to get plastic surgery. But this has changed. Through television and recording artists, it has become popular. Now, plastic surgeons are rich because every woman has had plastic surgery to make themselves feel better.
Now they feel better and have increased self-esteem. They feel younger, they feel more attractive, and now they can apply that same thing to men. So, yes, size matters.
Of course size matters, and as I said before, we are the pioneers in this area. We have to deal with a lot of controversy about what people believe about enlargement and thickening here in Mexico because we are the first to promote this.
You're not a magician, you're a physician, and these methods are scientifically proven.
That's right. However, in Europe and in the United States, at the clinics where I had my training, husbands and wives and boyfriends and girlfriends are all asking for this treatment. It is much more socially acceptable there.
That's why our women prefer them.
That's right. So, I think that when a patient can get over his machismo or shame, or when a patient can get past the taboo associated with this procedure here in Mexico, I think he will be more likely to go to his physician. I think that in 25 years, we won't need to be speaking of these topics in hushed tones or with embarrassment. We will be able to move on to other topics than elongation and thickening of the penis.
So, 2 inches in length, and how much in thickness?
When you measure the length, you should have almost the same measurement in circumference.
Aesthetically as well, this looks good?
Aesthetically as well. So if a patient has 6 inches of length at erection, he should have at least about 5 inches in circumference. With this size erection, he should have about 5 inches in length when flaccid, and of course much less thickness when flaccid. These are modern techniques, and they are within your reach. These are honest, proven techniques that are being done every day. These techniques have been proven in Europe and in the United States. We invite you to let go of your fear or embarrassment and give us a call. If you have a problem with length or thickness, please come to our office. We are available to help you.